Again, I want to thank again Nick, Linda, Hunt, and Winston Willie for inviting me today. I was here 2 years ago and was my first encounter with your foundation. I really commend you for your spirit, your enthusiasm, your passion about this project. And we had the fortune actually to have an event actually with Mart and Rachel participate in Indianapolis, and really the goal is to open a full chapter of the Judy Nicholson Foundation, Kidney Cancer Foundation in Indianapolis. So thank you for having me today. I'm going to try to be gentle with the mouse. It seems to be a very sensitive mouse. You can move it up to the podium if you like. Okay. Let me see if I can work this way. Perfect. These are my disclosure, but my real disclosure is that I have a prediction for tomorrow games, and it's probably higher than the Bing prediction. It's only 66%. I think it's higher than that. And this really comes from this. I sent this selfie to my kids through my wife. My wife sent me the message, but who is this guy? But actually, it's Chuck Pagano. We were flying together a couple of weeks ago from New York. As you know, he was a former coach of the Colts. Is a benefactor actually of the IU Simon Cancer Center. He's a leukemia survivor. So my heart is kind of blue. So I'm sorry about that with the Colts. Anyway. Today, I want to chat with you about how diet may have an impact on patients with cancer, and particularly patients with kidney cancer, I would say, and how we can use dietary intervention as really as a tool, we call it adjuvant tool, meaning a tool that helps patients with cancer. And the last part of my talk, I'm going to tell you about the story we try to build about protein restriction. You know, it doesn't probably make common sense to reduce the protein, but that's what we try to accomplish, and how actually reducing the protein, especially animal protein, can stimulate the immune system. So I want to just introduce a few concepts. You had a great talk from Dr. Drunk about immunotherapy, so I'm going to go through this very quickly, but this is really, when we talk about cancer, is a complex environment and interaction about genetics, epigenetics, and immunity. And as you know, the genetics, our DNA is where our codes is this long structure where our genes are included, and it's wrapped around proteins called histones. And this DNA in our normal cells is unfortunately susceptible to injury from carcinogens, from radiations. And unfortunately, when this damage occurs, these are sometimes inherited but not reversible. And when it happens, the DNA is altered, it's going to stay forever like that. Now, I thought that this quote was, again, these are from a long time ago, but this is a scientist at the Salk Institute to try to explain how the genome and the epigenome work together. Think about hardware and software. And when you say that the genome is like the hardware and the epigenome is the software. I can load Windows if I want on my Mac, but you're going to have the same chip in there, the same genome, but different software. So if you change the software, even if you have the same genome, the same hardware, the results can be different. That's why people are different, patients are different, and tumors are different, not just based on the genetic code, but also what we call it the epigenetic code. And now we know that these epigenetics, how actually genes are expressed, not just how are they altered, can be modulated by the way this DNA is wrapped around the histones. And there are drugs now available that can have impact how the chromatin, the structure where the DNA is wrapped around the histone and they translate to the expression of these genes is regulated. And we work, for example, with histone deacetylase and histone methyltransferases as a way actually to modulate gene expression not only in the cancer cells, but on the immune cells. So again, Dr. Dronka really give you a very elegant talk about how the immune system works. My slides are much more simple, but just to reinforce the concept that the immune system really works like a yin and yang system. Sometimes we need to activate our immune system when we have an infection, but sometimes we need to damp the response when the infection is gone. And so there are cells that suppress the immune response and cells that activate the immune response. So when you have infection, they balance it toward the cells that stimulate the immune response. Where there is cancer or inflammation, when we talk about this concept, the pendulum is on the other side. You have more cells that actually tell the immune system not to work in an efficient way. And what we're trying to do now with, as again, we heard before, these immunocheckpoint inhibitors that release the brake of this immunosuppression, the pendulum is back on the infected cells. And what we believe, we can actually tilt this pendulum even further if we are able to find a right dietary intervention or perhaps a right epigenetic drugs. So we're going to talk about diet. I'm not a nutritional as background. I'm a medical oncologist, but I saw the effect on the diet in animal study. I'm going to show you later on why I got so passionate about nutrition and how the diet really, we know, can prevent cancer, like not smoking, not drinking heavily, keep the weight down, but can also have a major impact on our patients who already have cancer. So there are many guidelines out there. This is from the USDA. These are the published guidelines for 2015, 2020 for Americans. And these are actually thanks to one of our dietitian, a registered dietitian, nutrition, Rachel Bordogna, works with us at Purdue. And some key message about these guidelines, for example, they recommend, I think this is very clever, we need to make some changes always in our lifestyle, in our diet. It's probably clever to do small changes, small shifts, because those are probably the one that will allow us to make a more durable changes down the road. And I think the concept that all the foods and beverages that we use counter to a healthy meal pattern. It's not just one element. It's not just one drink, but the entire beverage, the entire food we eat have an impact, and not single elements. Again, shift toward more nutrient-dense choices among food groups, small changes adapt, and really accommodate personal taste and cultural preference to make the shift easier to maintain. In the United States, we have a different culture, different ethnicity. How we can help our patient with different cultural background, with different ethnicity, to integrate the lifestyle change that we want to propose. I don't know if you can read this, but again, you're going to have this available, of course, on the website and on the videos. But we do have very clear guidelines on nutrition and physical activity for cancer prevention, but I think these are also applicable for patients who do have cancer from the American Cancer Society. These are available on the American Cancer Society website. This is a publication a couple years ago. There are, again, I'm not going to go over all this, but there are 4 main points that the American Cancer Society recommends. Number 1, achieve and maintain healthy weight throughout life. This is critical. And of course, how to maintain a healthy weight with diet and exercise. Adopt a physical active lifestyle. This is really basic concept that we should teach our kids as they are young. Consume a healthy diet with emphasis on plant foods. Again, I'll go over these in more details in the next few slides. And if you drink alcoholic beverage, limit consumption. These are really the 4 major guidelines the American Cancer Society has for everybody. And I would say not just to prevent cancer, but to cope with cancer, to cope, I would say, with cancer-related treatment and toxicity. I think everybody should know their own body mass index, or BMI. I know mine, and unfortunately it's not here. It's nothing more on the yellow range. But this is really, as you know, and there is a very simple calculator you can find on the website. You can Google it, how to calculate my BMI. But it's based on your height and your weight. Very simple. And you can know whether you're normal, you're underweight, you're overweight, or you're obese. Very simple. But I think everybody should know their BMI, because it's important to keep in mind that, and I'm going to mention again later on, as a target for any type of intervention. And I'm going to ask you to read this, but next couple of slides, I want to tell you, this is an article actually published this year from the Yale Fitness Intervention Trial. What does actually tell us? How difficult it is to follow the American Cancer Society guidelines. They did a study here where they have more than 150 breast cancer survivors, and they try to implement some physical activity and some healthy diet. And the conclusion that trial was that even in very motivated cancer survivors, the compliance and the adherence of these guidelines was very difficult to achieve. So this is the challenge that we have in front of us. Following this seems to be simple guidelines, but in reality is probably more complicated than we think. But these guidelines works. This is actually, it was amazing, this just came out in the JAMA Oncology. This was a large studies in patients with colon cancer who had tried to actually adhere to the American Cancer Society guidelines, do exercise, follow a healthy diet, and they show very nicely that actually those patients had better outcomes. So diet and exercise works, not just in, I believe, in colon cancer patients, but also in kidney cancer patients. And my hope is that we can replicate this type of studies also in patients with kidney cancer. So these are some of the slides that Beth Kirsch and other registered dietitian and nutritionist in the cancer center at Yale helped me to put through. And I think are very simple, but to me, again, are from a cancer-specific dietitian that look at the effect of nutrition and cancer. And I think have the objective of a cancer dietitian should be several. To identify goals of healthy eating for cancer survivorship. Again, we're not talking about prevent cancer. It's really these are patients who had diagnosis of cancer, who had perhaps nephrectomy, and now they're just wait and see, or they had the initial recurrence. Again, you're going to hear from Mart Rusma, my patient, my star patient, who's going to tell you about his experience with healthy diet in the context of a clinical trials. I think identify risk of malnutrition. There are some cancer type, tumor type that, well, malnutrition is definitely an early event. In kidney cancer, we do see it, especially, of course, at the end, unfortunately, at the end of the journey. But that's something that sometimes as an oncology we don't address. And I think having a dietitian in our clinic help us to monitor patients for malnutrition, because malnutrition is related to the cancer, is related to cancer treatment, But a healthy diet and exercise can help us to deal with that. And at the end, I have really tools that help our patient to gradually change their lifestyle habits. So cancer diets depends on goals that we have, based on the treatment the patient receiving, the side effect, and the appetite. You know, appetite, sometimes lack of appetite is a consequence of the cancer, is a consequence of the treatment. How the lack of appetite can not be just a challenge, but also an opportunity to find the right diet. Goals for nutrition during treatment: weight maintenance, adequate hydration, avoid nutrition-related treatment breaks, and maintain skin integrity. Again, I would say this is really a concept that are important for a cancer dietitian, where deals with many types of cancer, not just kidney cancer, and deal with, for example, with side effects from chemotherapy that we don't usually experience with our patients with kidney cancer because they don't receive chemotherapy, although, as you know, targeted therapies you learned this morning can be as toxic sometimes as a chemotherapy. We talked about malnutrition. Again, it's more on the end of the spectrum, but sometimes it can be also after surgery. For example, patients are not recovering well, and I think that is a challenge and that has to be in some way addressed. And as you know, 50 to 80% of patients may develop a malnutrition or cachexia during treatment. Again, it could be early stage, most of the time a later stage. And we know malnutrition is associated with increased morbidity, increased mortality, and perhaps even decreased response to therapy. So again, nutrition support might help to address this. And how we define malnutrition is really decreased energy intake over at least 5 days, weight loss 1 or 2% over 1 week, loss of subcutaneous fat or muscle, fluid accumulation, decreased functional capacity. So the registered dietitian can tell us, look, your patient is meeting these criteria. We need to have a plan for this patient to go through the treatment is going. I want to mention inflammation, because we heard about it a little bit early on, but to me it's still a very black box. We talk about inflammation, we really don't know what it means. We know that it's not good for our body, and it's not good for our patients. And if I had to define it, this is my definition, so don't take it for the granted soul, but I would say that the disorganized immune response is just the immune system kind of overreacting is not purposeful. But it can be harmful because we know that if there is a high level of inflammation, our good response, immune response, is not effective. If we have an infection, our immune system is not going to act quick enough. If we have a cancer, perhaps, the cancer may grow faster. If we have immunotherapy for our patient, the level of inflammation can suppress the outcome, the benefit. So why we want to address inflammation? Because I believe inflammation can be related to the eating, could be related to the exercise. So reducing inflammation can always, probably reduce the risk for cancer, but can reduce other comorbidities like diabetes, heart disease, that are important in patients with cancer. We know that can improve mood and perhaps reduce joint pain and improve blood pressure. This is a life behavioral changes that can be accomplished also with yoga, meditation, musical therapy, and others. But reducing inflammation in the body is maybe very important. Which are the food that causes inflammation? Again, this is a common sense, but as a reminder, processed food, excess meat, especially red meat, saturated fat. The good stuff usually, well, that tastes good, that is not good for our body. So an anti-inflammatory eating, and then that's a recommendation from Beth, is really avoid processed food and eat more plant-based foods, because they reduce these cytokines, these toxins that our body, our immune system is releasing. We still do not know exactly what's the mechanism, Perhaps it's related to the bacteria that we have in the gut. I'm going to mention about the role of the microbiota. So why at the end, again, Martha will tell you about the importance of vegetarian diet, perhaps even vegan diet. But plant-based, I call it plant-based diet, not necessarily strict vegetarian diet, but we know that plants contain vitamins, minerals, and fibers that seems to have a beneficial effect on our body and on our immune system. They are high in phytochemicals that can affect inflammation. And these are recommendations: 1.5 cups of fruits and 2 to 3 cups of vegetable every day. So fill half your plate with vegetable and fruits every time you have a meals. Do we do that? Do I do that? I try to do that, but we should do that. I should do it. Our kids should learn how to do it since they were young. Change the way you think about meat. I think it is, again, from Beth's recommendation, I think it's very interesting. Use it as a garnish. Limit the red meat to less than 18 ounces per week. I would be even more strict than that. I would probably limit this every other week or even once a month. And use beans, for example, legumes as a protein source. I'm going to tell you about the fascinating data we generated in mice when we changed the source of protein from casein, the protein in the milk, to the soy, for example, plant-based protein. So that's a recommendation from Beth, from our patient with cancer. Will increase intake of beans, seeds, and nuts. These are really good source of minerals, fibers, healthy fats, use in place of some of, or not all the meat in an entry for protein. Eat seafood twice a week. I love salmon. I think that's salmon. You know the protective effect of omega-3 fatty acid, and they're low in saturated fat. And also some preclinical data we generated with fish extract seems to behave like a plant-based extract. So more fish, more vegetables, perhaps poultry, less pork, less red meat. And in my list, actually, the no-go is really milk and dairy products, because I believe that casein, this protein in the milk and the dairy, is not good for patients with cancer. Use healthy fats in cooking and eating: extra virgin olive oil, nuts and seeds, avocados. Again, these are good source for good fats. And this, I think, there is really more and more evidence to switch diet to whole grains, because whole grains does contain more fibers, contain more minerals and vitamins, less processed food. Look for the label of whole meat. They are complex carbohydrates. They're not the simple carbohydrates that we burn. They are like polysaccharides, high in phytochemicals, old-fashioned oats, quinoa, whole wheat bread. And this is, I think, is a nice visual table, for example, to switch from white rice to brown rice. That's really what we're talking about when we talk about whole grains. Yes, and sugar is a problem. Simple and processed sugar is a problem. We were chatting before with Deb and others about this dogma patient has that, sugar is going to feed my cancer. I don't fully believe that. And again, talking with Dr. Drunker about the data on calorie restriction and reducing glucose uptake, it might have some impact. But we cannot eliminate, of course, the sugar. But if we need the sugar, just use the complex sugar, carbohydrates, not the simple and processed. And this is a famous Harvard plate. You saw it before. That's what is the healthy eating habit that we should all have. It's really a summary of what I already tried to tell you until now. Vegetables, plenty of fruits, healthy proteins that came primarily from plant-based, whole grains, water. We don't need drink sodas, right? We need to drink just water. Healthy oils. Of course, as Italian, I cannot live without olive oil. And of course, they stayed active. And these are the pyramids that, the famous Mediterranean diet that is so considered so healthy, and in some aspect is definitely healthy, but as you know, is really a pyramid where we want to be at the base of the pyramid, and we don't want to be at the top of the pyramid. And that's really the recommendation that, again, you all aware, we all aware, but now what we try to make sense is truly this is have an impact in our patients. Of course, we need to have more research on this. My take-home message on this, all the information that Beth, actually, our dietitian, registered dietitian, nutritionist, really prepare for us, is reduce inflammation is good. It perhaps is possible, especially during treatment with immunotherapy. Again, we heard a very nice talk about how these drugs that release the break of immune system may be so powerful, but they don't work in every patient. So my recommendation to all patients is really avoid dairy products, milk and cheese. Try to avoid red meat as possible. Increase plant-based protein fibers. There is a lot of data suggesting high fiber diet, and the fibers is in vegetables, fruits, legumes, nuts that may actually have an immunostimulating effect. Increase cruciferous vegetables, also they have high in fibers and vitamins. Eat more fish. I'm not a big fan of vitamin supplement. There is a lot of concern now on folate supplementation. There are some definitely studies suggesting that folate at a certain stage can, yes, prevent cancer, but when the cancer is established, it can actually become like a fuel for cancer. And if not, all the vitamin supplement contain folate. So if I need to recommend vitamins, with vitamin D and vitamin C, there is definitely a recognized role in the potential immunostimulating activity, and we can measure vitamin D level. When I was in Buffalo, we were all vitamin D deficiency because we don't have enough sun. Here in Florida, you're lucky, so you probably have more vitamin D, but I think checking vitamin D level is something we should routinely do. And again, I'm not going to address today this, but physical activity goes hand to hand with healthy diet. Now the data showing the regular physical activity, again, is one of the pillars of recommendation for the American Cancer Society. The benefit of regular activity is not just to live longer, but we know now it has an impact in patients, for example, with breast cancer receiving therapies. So a very regular physical activity, and again, I'm going to mention to you at the end, my ideal world would be to have a personal trainer for our patient who deal with exercise and deal with the diet. Over the next 10 minutes, I want to tell you about the research we've been doing how on diet and in particular protein restriction, and how we came up with that. So the left side are not, they're good food, but probably not the good protein. On the right side is the good proteins, legumes and nuts and vegetables. Well, there is definitely data suggesting that diet have an impact on cancer. This is the data on prostate cancer, but there are some similar data in breast and colon cancer. We know that patient or population that follow more a vegetarian type of diet, they have less incidence of prostate cancer, less aggressive type of prostate cancer, less level of insulin-like growth factors, IGF-1. This is a kind of gasoline for many cancer, perhaps including also some of the kidney cancer. And we know that a population has been exposed to animal proteins may have the reverse. There are definitely epidemiological data suggesting that patient who had low protein diet has less incidence again as they get older to develop cancer. But this to me was always been very eye-opener. This is a data in breast and prostate cancer. These are the incidence of breast cancer in Japanese women or in Japanese men in prostate. And when this generation came to the United States, you see the incidence of breast cancer and prostate cancer went up. And in particularly, let's say in patients with in the Caucasian awareness, actually similar to the Japanese who live actually in the United States, suggesting that the diet can actually have an impact in population like Japanese, we have a lower incidence of breast and prostate cancer. These are data from Luigi Fontana. Luigi is a well-known nutritionist like Walter Longo that taught us the role of protein restriction as a way to actually live longer. You know, if you decrease the animal protein, you decrease the aging process. And one way is probably because you lower the animal protein, you lower these growth factors that drive the, for example, the mTOR pathway, the mammalian target or rapamycin pathway. So years ago, I met with Luigi, who had this great data on aging and protein restriction, and we decided, but why we don't look at the effect of protein restriction in prostate cancer, in cancer. So that is, again, was 5 years ago, more than 5 years ago, when we started this project. We just changed the diet in mice. The normal protein content is 20%, like in human beings. We drop it from 20% to 7%. We increased the carbohydrates. So these mice were getting the regular calorie, but the source of calorie was more from carbohydrates than from protein. And just making this simple change in the diet, it was like giving chemotherapy or hormonal therapy in these mice carrying human prostate cancer. This is the way we test drugs or test intervention. We grow this tumor in the flank, we measure it, and this is the tumor that keep growing. And if the mouse has started this diet restriction, a protein restriction 1 month before, the tumor is sitting there. If we establish the tumor is big enough now, and now we do the diet intervention, we still have an impact. And, you know, again, we published this years ago, and to me it was a eye-opening. So how they just change the diet, change the protein in these mice has such a remarkable effect. But this, if anything, I want you to remember these slides. Again, it's going to be on the website. But we did this experiment. Not only we changed the protein contents, for example, from 20% to 10%, but we changed the source of a protein. So we give the diet only soy or only casein. Casein as a milk product, you know, like animal proteins, or soy as a plant-based protein. And we saw the same difference. If we give normal contents of proteins, but these proteins come only from the soy, we still have inhibition tumor growth. So suggestion is, yeah, we can reduce the total protein, but even change the source of the protein makes a big difference. We did recently, again, I'm going to go over this quickly, an experiment in kidney cancer model where we did the diet restriction with the immunocheckpoint inhibitors, so like a PD-1 inhibitors, like a type of Keytruda, like a pembrolizumab or a nivolumab type of drug. And we see remarkably these mice live longer if we reduce the protein and we give an immunotherapy. They respond better to immunotherapy. And we come up actually with a potential mechanism that we shift this macrophage biology. These macrophages are cells that can be a good helper of the immune system, but can be also a foe of the immune system. And just the protein restriction, or in some cases the methionine restriction, one of these essential amino acids, can have a major impact. So based on this observation that actually reducing the protein can enhance the response to immunotherapy, we designed clinical trials. This is a trial open in prostate cancer at the Indiana University Simon Cancer Center. These are patients that prostate cancer eligible for vaccine called Sipuleucel-T, and the dietitian is preparing meals for 7 weeks with low protein or normal protein. And we're going to see whether the immune system is responding differently. And we're going to try to open parallel study in patients with kidney cancer and melanoma receiving immunocheckpoint inhibitors to see whether low protein diet, just for a short period of time, can have impact on the immune response. Because there is a way for us now to measure the immune response, to measure the quality of the immune cells in the blood. I want to just mention also, and I alluded early on the microbiota. All this effect on the diet, I believe, is not just because the tumor cells, the immune cells need amino acid to function. Yes, this is one mechanism. But the other potential indirect mechanism is that the diet changed the bacteria in the gut. And as you know, the bacteria in the gut are very important because now there is clear evidence that can regulate, can make us feel well or sick, and can regulate the immune response. This is one of papers years ago showing that chewing down on meat dairy alters gut bacteria a lot and quickly. That's true, that there are some good bacteria that are suppressed with red meat and dairy products, and there are bad bacteria that actually come up with a diet rich in animal proteins. So our effort is actually to dig into it more on this concept, how the protein restriction in our hands can affect the bacteria in the gut and how this can have an impact in our patients. So that is really my dream slides for our patient with kidney cancer, that we're going to learn more about the bacteria in their gut. We have a protocol now where every 3 months we are collecting blood, and in the near future also we're collecting stool to characterize the bacteria in their gut and to see whether they have, we call it good bacteria, or they have a bad bacteria. But I believe that these can be affected by diet, and they can help, again, the immune response. We also have a program where patients undergoing resection of the primary tumor, we're trying to put this tumor in the mice, we're trying to isolate cells, and we are doing some dietary intervention. We restrict amino acid, we do this alternating fasting, we give a high fiber diet, and try to come up with the signature. There are some patients that might benefit from low protein diet, some other patients we're talking about ketogenic diet perhaps. Alternative fasting, high fiber diets is probably how the tumor is driven. This is actually a big accomplishment we're going to implement hopefully next month. We're going to open a clinic for nutrition. Actually, this I to give a credit to Dr. Gridline, our chief of service line, come up with these acronyms. It's called SNAC Clinic. I love it because there's no K, but it's a science, nutrition, and cancer clinic at the Yale University. And the concept is It's going to open to any type of cancer, but particularly be focused on kidney cancer. Patient who had surgery, who had recurrent disease, we're going to have a dietitian going to start seeing this patient on a routine basis. 1 month after the first baseline, and then every 3 months. And what we're going to do, we're going to check their weight. We're going to have a very weight maintenance, a weight losing program for them through the diet. We're going to look for metabolic syndrome. These patients are developing diabetes or hypertension. And we're going to look for inflammation. We're going to collect blood and stool. So this is a very exciting project that we're going to start, and it's something that I think a lot of people are thinking about, and I think maybe exploring also here at your institution with your foundation. It would be great. I think that's what should be our goal. Again, this takes a lot of resources, but I think your foundation can help us perhaps to try to achieve that. I think our patients with cancer, in particular kidney cancer, need personal trainers for physical activity, but also for diet. And I think the dietitian should become a personal trainer for them. Because these patients at different stages of the disease may have different nutritional needs. They can lose weight. They might need to lose weight at the beginning. They might need to maintain weight at a certain stage of the disease or the treatment. But only to have a dietitian, a registered dietitian, can help us to achieve that goal. We can accomplish that only through that. And this is, I think, in my final slides, really my dream as a comprehensive. We heard a beautiful, exciting presentation about yoga. I think we should envision patient care like a clubhouse, where patient goes there to eat healthy, to learn how to cook healthy, to have a metabolic kitchen there, to do meditation, exercise, yes, and also get treatment in the same place. So this is my last slides, and I hope I try to make the case that an integrated nutritional support for our kidney cancer is an unmet need. Our overall goals at IU and the Yale University is integrated epigenetic immuno-based therapies and diet intervention for kidney cancer. I didn't have a chance to go over all that research effort. But at the end, we want to improve the quality of life and implement survivorship initiative for our patients with kidney cancer. And I think this is already happening about establishing a chapter of the Judy Nicholson Kidney Cancer Foundation in Indianapolis. So for this, thanks for listening. I want, again, special thanks to Beth Kirsch and Rachel Bordogna, our registered dietitian at the IU and Purdue University, helped me to put these slides together. Thank you. Yes, Linda.
How many grams of protein do you think is for everyday living?
Well, I think it's based on actually on the amount of calorie that you need. So I would probably start have a discussion with the dietitian to see how is your calorie need, caloric need. And really the caloric need is based on your body mass index. And once you have your caloric needs, you sit down with the dietitian and try to break down the amount of protein that you need, the amount of carbohydrates that you need, the amount of fat you need. But you still need to have probably 20% of protein, 40% of carbohydrates, and 40% of fat. You still need to have a balanced diet. So once you have that calculated, you're going to have your 20% of protein. My bias is to have that 20% of protein coming primarily from plant-based. But there are good animal proteins. I mean, fish and poultry probably, especially fish, are good. Red meat milk, cheese? Probably not. Yes, Nick.
I've been encouraged to try apple cider vinegar. Is there any value to that? Is it an old wives' tale, or is it some value to it?
But I don't know whether they just come up with about the acidity or fight the acidity. I don't know about that. I mean, I know that there are some believe that vinegar may help. I'm not sure. I think, honestly, to me, the major impact that I see preclinically in animal studies is calorie restriction and protein restriction. To me, those are the two major the intervention that I see the most. High carbohydrate diet definitely been shown to maybe to promote some type of cancer. But I think the impact of protein and the impact of calorie is far greater than the impact of carbohydrates or either agent that may affect the acidity. Some patients say, but should I affect the acidity of my blood? I don't think the cancer cell cares about that. To me, it's fascinating, it's humbling, because there are more things that we don't know that we know. But I think we need to get nutritionists, dietitian, medical oncology, microbiologists, tumor immunology get together. And that's what we're trying to do at our institution, and have a working group and create a center of excellence for nutritional science. But I'm going to have Linda to introduce Mart, I think. But you're going to have, I think, a contribution from Mart about his experience of following a vegetarian diet. And so we're looking forward to, and thank you again for coming, Mart and Rachel. I appreciate your.
Well,